Hi, welcome back to the podcast. And for part 2 of this conversation with my friend and colleague, Rosie Tadman, on some of the causes of underlying infertility, or shall we say sub-fertility or fertility challenges. Definitely go back to part 1 of this episode if you haven't already. So it's just from last week, because that's where I go through more about Rosie. But basically, she is a nutritional therapist like me who likes to focus on the root causes and supports individuals, and she specializes in fertility, hormones, and yeah, if you're going through something like IVF, she can help you through that as well. So in last week's episode, just to recap, we just got onto 2 of the common root causes that Rosie sees, and that was vaginal and endometrial microbiome imbalances, and also how poor egg and sperm quality can contribute to. And I did a little teaser and I cut you off just as we got into the juicy bits, but I was basically asking Rosie, how do we treat some of these underlying infections that can contribute to both poor egg health and this oxidative stress, inflammation that can drive not only fertility issues, but a lot of diseases and conditions, and also things like vaginal infections, endometrial infections, whether it's E. coli or a sexually transmitted one. So I was just getting into Rosie's answer with that. So I will resume the episode in a second. But in this part, we cover how a few of the other root causes, such as stress and trauma, luteal phase defects, low progesterone, and thyroid issues can contribute to fertility issues. And she shows how vaginal pH strip testing can be a really cheap and useful tool to see what's going on with your vaginal microbiome, how you can track your cycle, your temperatures and cervical mucus to help you understand your body and fertile window for optimal conception timing, and why you need to be aware of some of the products that you're using vaginally, whether that is even organic tampons. She made a really important and there's something that I thought about afterwards, really important point on whether you should be using tampons at all. I know they're convenient, but in terms of Chinese medicine, sometimes you just want to let that blood flow. So that's something that we discussed in the episode. So I'm not going to leave you waiting any longer. Let's get into part 2 of root causes, underlying imbalances contributing to infertility with Rosie Tadman. And yeah, enjoy. Amazing. And what would be the solutions? I know it depends on like what the imbalance is, but what are some of the most common imbalances that you see, and what's like an overview? How would you treat it? Would you do things vaginally or internally or from both angles?
So it might be that there's a pathogenic bacteria that comes up. Then I would usually be recommended, I'd write a referral to the doctor to prescribe antibiotics. And I would, because usually, people are on this time frame, they want results. With that, I would always make sure that they are on some sort of biofilm disruptor alongside the antibiotics.
And what type of bacteria is it? Things like strep or?
It's like ureaplasma is a big one that I often see. That's probably the biggest one. E. coli is huge as well, which is often the root cause of most people's current UTI infections, often E. coli.
And are they're meant to be there, or are they meant to be like the urinary tract, or is it just that they get overgrown?
Overgrown. And yeah, so they're like the big ones that I would often see. But I'd need to have a look at an in vivo report. They break them down as pathogenic anaerobic bacteria, pathogenic anaerobic bacteria. And that's important to know which one they are, because they will then hopefully respond to antibiotics, but they need to be different antibiotics.
And have you ever done I know you said in just the matter of time it takes, it's going to be a lot less on regular antibiotics versus herbal formulas, but have you ever helped anyone successfully eradicate through the herbal stuff?
Personally, just done the herbal route with something like a pathogenic bacteria like ureaplasma.
And are the doctors usually on board if you write to them? And
yeah. And that's the same whether it's the vaginal in vivo test or I did the fertility endometrial one, and that would still show up pathogenic bacteria. So that's one thing that might come up, but also it might come up with candida, like that is something else that would show up. And also it might, I would also potentially use other herbal or otherwise things when someone does have a pathogenic bacteria that requires antibiotics. Yes, I'd use the biofilm disruptors, but maybe also other things as well. So that would be full body, and sometimes also vaginal suppositories would be included within that. So I'd kind of like try and support it from both angles. And then sometimes people have, which this is like usually the simplest one to sort out, is no issues other than pure deficiency of lactobacillus, which is the beneficial bacteria within the vagina. Then that can have major impacts and really mean that implantation is an issue, but it's often so much easier to rectify.
Could that be literally just taking a lactobacillus probiotic, which is one of the most common cheap strains anyway, isn't it?
Yeah, and inserting it vaginally.
Wow.
So
would it work if you took it internally as well, or not as effective?
All of the research that I've read from like Biomedica, the Australian company, they've done a lot of research that I've read around lactobacillus, and all of their research is done on taking it orally. Interestingly though, when I've spoken to their rep, they're like, oh, but do it both, you know, just in case. Always recommend it.
You might as well.
Might as well. You know, just inserting a lactobacillus supplement vaginally.
What about pH level, or is that mainly affected by the lactobacillus? So kind of like it can be a problem, but it's probably due to like an infection or deficiency, or a deeper problem.
I would say like pH is the first indicator that you'd want to look at to see whether things are out of balance. And if that pH is too alkaline, then 9 times out of 10, when you look further down the report, you're about to find out why it's too alkaline. But the anaerobic bacteria don't always change the pH. So you might also have someone whose pH is totally normal, and you're like, oh, I'm about to scroll down and the report will just show there's no issues. And then they've got big anaerobic bacteria, but that just doesn't change the pH. So that still needs to be rectified, even though their pH is fine. But if someone's pH is out of balance, then a weekly test, just useful at-home test to know that things are changing without doing another £200 in vivo vaginal microbiome test, is vaginal pH, the test strips. So
is that different to the urine ones?
Just so long as they can be the same ones, but you just need to make sure that the pH is within the right range. So it's at least
versus urine. So look at the proper ones for vaginal health versus urine health.
Yeah, because they need to go from really like at least like 3 to 6 or 7. Okay. And we can get them on Amazon, like they're really so that can just be a good way to know if someone knows their vaginal pH has always been out of balance. Oh well, I'll just buy some of these off Amazon, and I can see if I'm doing it weekly that it's moving in the right direction, with also the knowledge that pH will naturally in the vagina will naturally fluctuate throughout the cycle anyway. So say for example during ovulation, pre-ovulation, we want our vaginal microbiome to be slightly more alkaline anyway, because we want it to welcome in sperm and not to be too acidic to kill it. Which the flip side of that is that if you've got a vaginal microbiome that's out of balance, then you're having sex in your fertile window, and your partner who you're having sex with has actually got an infection in his sperm, you're then more likely to be affected in that fertile window, which is ironically the time that you need to have sex.
Okay.
See how it all.
Yeah. It makes total sense, but then people still think like, oh, it's just bad luck, or I'm just infertile. And there's so many different reasons that it could be. But you'd always want to start with like the basic things first. Are you having sex at the right time of month? Which you'd be surprised. People are just not aware of the fertile window.
Yeah.
That's how surprise pregnancies happen as well.
Totally.
And what about things that we kind of use personal care wise, tampons, even there's these like gels and stuff that claim to like support fertility. creams and lotions and all sorts of things. Like, what are your thoughts on what we put in internally?
Massively important. I think, to help the vaginal microbiome, don't put anything internally within your vagina. Make sure that they are free of all of the nasty toxic chemicals, whether you're wearing reusable, washable period pants or pads. But really, unless you really have to wear a tampon because you're going swimming that day or whatever it is, I'd say just steer clear of anything internally. I know within like Chinese medicine, like in terms of like energetically, you're really stagnating that energy when you really want it free flowing out of your body.
That's something that I need to, because I just wear tampons, because I'd for years used a menstrual cup, and then 1 month, for whatever reason, it just got stuck to my cervix.
Really?
Yeah, and I couldn't get it out, and now I've got like trauma around menstrual cups. It happened multiple times. I wanted to stick with it because I just know that there's so much easier, but then I went to see a pelvic floor physio, and she said it's quite a common issue. And yeah, it was basically like pulling down. So if I would have pulled too much, it would have caused a prolapse. Yeah. So I stay away from those now, but I'm just used to using organic tampons, and it doesn't cause me any pain or anything like that. And they're way more convenient, aren't they? But with what I've been reading more recently, especially like the energetic side of things and Chinese medicine, all of that, I think I need to start wearing pads or just the period undies instead.
I think they're all like mix it, like, or most of the time, like, if you're at home and like wear a pad, but then, if you are, I don't know, like going out and that just works for you for whatever reason. But yeah, I think especially if there's some sort of dysbiosis, don't wear tampons. But arguably, I think in general, it doesn't really support vaginal microbiome and the energetics of it.
Are there any, like, I don't know if they're like lubricants or something that people say that help them conceive? Or are there any like positions or any like, these wives' tale things that we hear? Is there anything that's actually like legit that's worth trying?
So I'd say like Pre-Seed is the lube that they have tested and shown that it doesn't kill sperm. So, and even for clients,
so it's not like it helps you conceive, it's more like it isn't toxic like all of the other ones.
Like both. It's like being sold as a lube to help conception. So I would say, like, ideally you want your own lube, which is good cervical mucus. Like good cervical mucus is like the motorway for sperm. It's like literally it's that nice smooth road that will take the sperm right up into the fallopian tubes and will help them meet.
Isn't it crazy that our body just makes it on its own?
Like so magical. But so Pre-Seed, I suppose, have like looked at what's in cervical mucus and trying to mimic that. So that could be something definitely to consider, because sometimes on one of the horrible ironies of Clomid, which is an ovulation induction drug, is it can really dry up a woman's cervical mucus, which is so vital. Yes, secondary to ovulation, but only just by a smidge. So say potentially Pre-Seed might be something I'd recommend to someone like that. And old wives' tales around fertility. I mean, a female orgasm can help conception. It's quite literally like that, sucking the sperm up into the cervix and the fallopian tube. Then like position wise, I don't know enough really about. I've not read anything that is that like conclusive. I mean, like, if anyone's trying to conceive, I'm pretty sure they'll keep the legs up in the air, like, just in case it makes it. But
it's never been confirmed.
It's not been confirmed. So yeah, but equally, but say things that help don't mean that you can't if it doesn't happen. So like, obviously you can conceive without having an orgasm, without having cervical mucus, but they are definitely things that can help.
Great. And I was just thinking, with your protocols, so if someone has a bacteria or fungal overgrowth and you're working on that with them, or maybe they're taking the conventional antibiotics, what do you advise in terms of them continuing trying to conceive during that time? Is it better to just have a break,
Definitely
get their health better, or is it okay if they continue? Because I know it can take a while and they feel like they're on this ticking time clock anyway. But yeah, what's your advice?
On any vaginal protocol, and they would normally, I would try and keep them to less than 1 or 2 cycles. So it's like, let's go with the vaginal irrigations along with systemic body approach. And we'll already have done like pre-work before we're moving on to that ideally. But try and not have unprotected sex, just because quite often there is a cross-contamination happening. So just while there's that vulnerability within the vaginal microbiome, only have ideally protected sex, which mostly I think people are up for, especially if they're symptomatic.
Yeah.
Because like having thrush all the time or having BV is pretty, yes, okay, it's not life-threatening, but women will be like,
they'll do anything.
And I mean, they're the instances where a couple haven't conceived yet, or a solo mum-to-be hasn't conceived yet, but I've helped them eradicate their thrush or BV or whatever it is. And that's a lovely moment when you know you've got their trust, like even though they've not conceived yet, because you've helped them with this massive thing in their life.
Like, okay, what you say works, well, just continue to do whatever you say.
Yeah. Like they're like, I'm recommending you to my friends, because it's been such a debilitating thing, which you can totally see, especially if they've been on every single medication to try and resolve it and it's not resolved.
The best feeling ever, isn't it?
Yeah.
So good.
Yeah.
Great. So next on the list is how stress/trauma can cause or contribute to fertility issues. Is that localized stress and trauma to like the vaginal area, or from some sort of surgery if they have endometriosis, or do you mean like emotional, energetic?
I would say, I think I was more, when I think wrote it on Instagram, more kind of thinking that broader systemic trauma. This, I should say, like, is not my area of expertise at all. Like, say, once I've supported someone with all of the other things and say they still haven't conceived. So say like after every round of IVF, if it hasn't worked, we'll always have a call in the diary to discuss how it went, what happened, what was the quality of the embryos like, what was discussed, etc. And sometimes, and I'm always keen to never write someone's story. I would never say like, I think maybe there's trauma involved in your sub-fertility story. But I might ask the question about like, what do you think? Do you think there might be an emotional, energetic, depending how you often get an idea of the words other people would use to describe their situation. So I try and always like mirror the language they may use. So it might not be trauma, or it may be trauma, depending on what I think they would describe it, and see what their response is, and see whether they would be up for me recommending, or whether they knew anyone who could support them with that. So I think the whole like with everything, does stress impact fertility? I think it can, but I don't think it certainly doesn't for everyone. You could be the most stressed person on the planet and conceive. But that doesn't mean that it can't affect some people's fertility.
And what are some of the most common? Does it have to be like specific to their like sexual health, or instances of like abuse, or like they don't believe that they can get pregnant, or are you just talking like general life stress?
All of the above. I think it could be sexual trauma. Yes, it could be childhood trauma. It could be general life micro stresses that have all added up to be a completely dysregulated nervous system. All of them. I think it's so varied.
Do you ever have people where like deep down they actually don't want to get pregnant?
I've definitely had people where,
or their partner even.
I've certainly had that discussion with clients, and they've said to me, you know, things like, there is a bit of me that worries about the world, and is it really the time to bring a child into the world, given, you know, we start, you know, talking about like climate change and all these things all of a sudden in like a client consultation, or is it really what I want to do? Maybe I'm not getting pregnant because really I don't want a baby. And that's when I am really clear that I'm not a psychotherapist, I'm not a counsellor. I'm more than happy to hear your story and to hear where you're at, and to try and let's see if there's someone out there who can help you deal with those things, if that's what you want to do. And I think that's where the signposting comes out of it. But I think sometimes people would come to me like psychotherapy or somatic work or nervous system regulation, like might not even be things they would know to put into Google to like look for someone, but they might know nutritional therapy. So they're like, and there might also be lots and lots of physical things to support them with. And I think sometimes one of the lovely butterfly effects of complementary therapy is the work that we've done together has now given them energetically more capacity to deal with X, Y, and Z trauma, or to talk through that.
Yeah, it's a huge thing that I emphasize as well. So I would say, like, I'm not a trauma healer, but we strengthen your body up and get you physically detoxing, it'll mean that when you do go to someone, you have that resilience, because it can be a stress to clear trauma from the body or go through like difficult times, like relive them. But if we strengthen you up a little bit, then it's going to be more successful than if you go in deficient and constipated physically, then you're not going to be emotionally able to release. And when you refer people on, so let's say that they have this mother wound, they had a really bad relationship with their mum as a child, and subconsciously you've identified that they don't want to kind of have that happen again with their child. I've heard that can be a common problem. Do you send them to like a conventional psychotherapist or counsellor? Or I know we were talking before about practitioners who do like womb circles and healing somatically through like dance and all of this like more holistic side of things, or is it again a combination dependent on the person?
I would often at this point have had a feel and will have spoken about what they're open to. And then off the back of that, I will try and send them a nice smorgasbord, a nice menu of different practitioners that they could contact, but also just different things that they could maybe think about doing in their everyday life that I know isn't going to trigger and make any trauma worse, that can just really gently help to regulate their nervous system, whether that's like journaling, walking, gentle breathing, baths, you know, all the generic kind of things, whilst they're looking at who might feel right for them to take that next step with. So there'll often be a mix. It might be talking therapies, someone who does talking therapies, it might be someone who does more somatic work, it might be a hypnotherapist. I'll try and give people a bit of just a few different options so that they can see what resonates with them when they look at people.
What do you think of more of those, I want to say woo-woo, but I believe like more spiritual side of things like womb healing, or even things like reflexology? I had a client who we were working together for a while. She wanted to get pregnant, and she swears that on top of the work that we did, reflexology was the thing that got her pregnant in the end. So yeah, do you have any like success stories or recommendations for things for people to look into, or things like acupuncture? I know that that's been clinically like studied, and they even use that alongside IVF a lot of the time.
I think in terms of like getting the body back into balance, I think there are so many different modalities that can help with that. And I think it's finding the ones for you that work. So whether that's Reiki, whether it's reflexology, whether it's acupuncture. Acupuncture is the one that we talk about most because it's the one that's most clinically researched. But I found for some clients, Reiki, energetic work, for them is so much more powerful and they feel so much more benefit than acupuncture or vice versa. So I think it's about finding out what helps, because ultimately we know, even through science, that the body keeps the score, as the book title is named. What I don't think the body side of things does, is if someone has got something emotionally that they need to physically verbalize and work through, then I think that's when talking therapies has its place. They kind of need to go through that to then be able to also process it within their body.
Yeah, because otherwise it's kind of just like lay on a table and someone's going to heal you, whereas sometimes you need to like process. And there's also the other side though, where just talk therapy and just going through in your mind isn't enough. You have to physically release. So a combination again approach is good. And like what we do, we focus on the physical body, but then we also refer out to people who work on the emotional, energetic too. So it has to be holistic and address like from all different angles.
Yeah, I think they've all got their place and they'll all help different people. I don't think there's one panacea for health. Like there's no one modality that can help every single person, including nutritional therapy. Sometimes that isn't right for someone for whatever reason, in the time and place within their life. So I think it's about finding out what would really suit you.
Yeah. And then there's another 2 points that I want to cover. So 2 other causes of fertility issues. One of them is a luteal phase defect. The other one is thyroid issues. And typically that's going to be more underactive thyroid, although overactive could contribute as well. So yeah, what do you want to cover? Because I'm sure that the things that we've discussed tie into that. So things like cervical mucus is important. Things like addressing your stress and trauma, clearing any infections, improving your diet and your lifestyle and endocrine disruptors, all of that. So other than those things, for the luteal phase defects and thyroid issues, is there anything else you want to add?
So I'd just say like low progesterone is now starting to be recognised within conventional medicine as a reason.
Is it not already?
No.
That is ridiculous.
It's kind of now moving out of quackery to starting to be recognised.
Like, progesterone is the pregnancy hormone, so how can it not be connected?
You ovulate, so you're fine.
Okay.
I know, like mind-boggling. Absolutely mind-boggling. So yeah, I would just say it's working on egg health. It's working on your thyroid, then affect your egg health. It's all these things affect thyroid. They affect luteal phase defect. would you just with your clients get everyone to test the thyroid even if they're not symptomatic? How common do you see thyroid imbalances? I would always get a basic thyroid panel done for everyone. Normally that will already have been done. And if they've got any autoimmune history, then yes, would check antibodies as well. Make sure that the cofactors for thyroid are optimal, so your vitamin D, your iron, things like selenium, HTMA, thank you for training me that, is important. So yes, I'd always get a basic panel done.
And why does the thyroid affect fertility and hormones?
So your thyroid kind of sets the pace for everything within the body. And your adrenals, thyroid, ovaries are like that little triangle of triad of friends.
Mm-hmm.
And it can impact, say hypothyroid could impact something as basic as ovulation, or an ovulation if it's not working properly. So thyroid is integral to everything, and sometimes it might be that your TSH is fine or your T4 is fine, but maybe you have got the autoimmune form of thyroid disease, Hashimoto. So there's an immune issue there, although there's not a primary thyroid disease, but that can still affect fertility. And I'd say
that's the most common factor, isn't it? So yeah, definitely something worth considering. And symptom wise for thyroid, it's basically like everything slows down. So I think brain function, skin cell turnover, hair growth, digestion, even things like detox and constipation. Just think everything turns down, and then hyperthyroid, overactive, everything speeds up. So the opposite. And yeah, if it is autoimmune, with it being an autoimmune condition, Hashimoto's, you want to address the immune system, which is in the gut. So this could be another reason to address the microbiome. And this might tie into the vaginal and endometrial microbiome, but could also be separate. And then the luteal phase defect. So basically, the quality of your egg determines the quality and the production of your progesterone. But what do you exactly mean by a luteal phase defect? How do we know if we have that?
So from ovulation to your next period, you want at least 10 plus days of a 0.2 rise in temperature, at least. Anything shorter or lower in temperature, then I would say potentially there's a progesterone issue or a luteal phase defect. That is potentially most probably hindering your fertility.
And do you recommend like the old-fashioned thermometer and paper charts, or any apps, gadgets and tools?
I mean, you can do it as something as simple as a 0.2 decimal place thermometer, as long as you're doing it the first thing in the morning before you get out of bed, roughly the same time, or jot down if it is a different time. What I find with clients is, especially if they've been trying to conceive for a while, that's like the daily reminder that they've not got a baby anymore at the moment. So can kind of like set the day off to be like really, really stressful, which I totally get. And going back to nervous system, we don't want to already start the day dreading it. So even things like temp drop, like the ones that you wear, or OvuSense, that's internal. I know like Aura Ring are now teamed up with Natural Cycles. So if it, like the continuous monitors don't mean that you've got to like remember to do it at the same time you're not starting your day. The downside of those things are you've got to pay for them, and they're often a lot more expensive than a £10 thermometer off Amazon and a paper chart. Read Your Body is a lovely online app that you can input into. I'd say just don't use, a big mistake that I often see clients making is they'll use the ovulation prediction as a gold standard for when they're going to ovulate over their cervical mucus. So usually
the strips.
Well, the strips,
yeah.
But also just the predictor in the app.
All right, okay, yeah.
Like, you're going to ovulate in a couple of days. Like, well, your bodies could change month on month. Just because you've ovulated on day 12 for the past 12 months doesn't mean that you are going to this cycle. So always use your cervical mucus or fertile window over temperature.
And what are we looking for with that?
So changes to it being wetter, egg white consistency, slippery. That's peak mucus. So the last day of fertile mucus, so wetness or the egg white consistency, slippy, it's then 80% chance that in the next 24, 48 hours you will ovulate. You only know obviously your last day of fertile cervical mucus when you've had your next day and you've not had any type thing. So again, it's only retrospective, but anytime that you've got fertile cervical mucus, you've got that motorway for sperm. Sperm can live up to 5 days. So that's when you're most fertile.
So you want to be trying like multiple times a day?
I'd say like once a day within your fertile window will suffice. But if you like miss a day, it's not like, oh, it's no point. Just try at least once a day within your fertile window. But I know like urologists, in terms of sperm health, you really want to be ejaculating at least 2 to 3 times a week to help that oxidative stress within sperm. Like that's a really like simple way to reduce oxidative stress is we'll make sure it's turning over regularly.
Yeah.
So even within like conventional medicine, I've not come up with that advice. That's what I've heard time and time again. Fertility specialists say that you want that sperm turnover to be consistent throughout the month. And that can be them self-pleasuring by themselves. It doesn't need to be that it's necessarily like you having sex. So I totally get like, you know, there's sex fatigue that can happen with a couple. That just turnover needs to ideally be happening consistently.
With tracking, so the woman tracking her temperatures and everything, is there a point, because I'm at the point now, not that I'm trying to conceive, but I just kind of know, like, there's no need for me to track. I know that my temperature's rising, or would you say just while you're in that space, you just want to make sure that your temperatures are 0.2 higher at least?
I would say
post-ovulation.
It depends on the individual. I think it's useful information to have for a few months, like 3 or 4 months. And that could be the 3 or 4 months. Say if you're planning in advance, I would usually say like, get the data whilst you don't need it. Because like, whilst you're not like really invested in it, like just track your cycle for 3 to 4 months, because you don't want to get pregnant yet. So you're not going to be like, oh my God, what is it? And often women know when they're ovulating, or they might know, not obviously, some will, but that doesn't tell you what your progesterone is. So I'm more looking at tracking your cycle for your progesterone than for ovulation. So yeah, women will often say, but I know when I'm ovulating or around when I'm ovulating, but I'm not really asking. The tracking your cycle is that progesterone piece, not the ovulation piece, or just the ovulation piece.
And is it worth testing progesterone as well? And which method would you use?
You could do, but really tracking your cycle through temperature is a much better way than a blood test at a certain point in time. Equally, the best case scenario would be get them both and build up a really full picture of what progesterone looks like. Because what you can do with a blood test progesterone is, even if you do it at the right time, so say 7 days after ovulation, and say if that progesterone rises sufficiently and it's showing really healthy progesterone, that's not to say that then a day or 2 later someone starts their period and their progesterone, some people's progesterone can curve really nicely, but then it literally drops off a cliff, and that's when in theory they've had the progesterone test and it's fine, but their luteal phase isn't long enough.
That's why the Dutch, I don't know how often you run that, the Dutch cycle map can be better, because you can then see the month fluctuation rather than a snapshot in time.
Yeah, the only thing with Dutch is it's expensive. You can only you'll probably do 1 month, whereas with tracking your cycle you can build up. Really, you want to see like 3 before you start like saying, oh, there's progesterone issues. I'd say that I want 3 cycles worth of temperatures, then let's talk about them. Otherwise, like, you can have a cycle when you don't ovulate and there's nothing even wrong, just on that particular cycle you didn't ovulate, whereas the last 30 you did, type thing. So yeah, I would say it's more the patterns that you want to look out for rather than fixate on one cycle. So
if someone's not trying to conceive and they're listening, if you have a particularly like painful period 1 month, if it's just a one-off, then obviously try and like understand why that happened and look back 2 to 3 months ago. But it could just be a random thing that can happen because you didn't ovulate, travel can throw it off, or illnesses. So I would say the same with symptoms. As long as they're not reoccurring and ongoing, then don't try to stress too much, because then that's going to make everything worse.
Yeah, that like need to know exactly why.
That's exactly what my brain is though. I'm like, what's wrong? What do I need to do?
Yeah, and when you're trying to conceive and you desperately want that baby, that is it's easier
intensified. So I think we've covered a lot and we could go on, but is there anything that you really want to make sure that we finish up with? Any important points, or do you feel like that is a really like thorough overview?
I think that's a very, very thorough overview.
And I want to have you back on because we want to do like a fun chatty episode, and I'm sure the listeners would love that as well, like 2 nutritionists just chatting about mistakes we've made and we were messaging this morning about how much we've changed since college, and even at the beginning of this episode we would like just cringe at some of the things that we did back then.
Worthy.
But if you want us to do an episode on that, let us know. We'd definitely be up for it. So stay tuned in a few weeks. Hopefully we'll have one of those episodes come in. But I always finish the episode with 3 questions for you. So the first one is, what's something that you're into lately? So this can be health related or it can be completely random.
What is something I'm into? So trigger warning, this does talk about children. So I'd say right now, given this season of life, I'm really into going to bed early.
I am, and I don't even have kids.
So I think right now my life is very much work and family, and there's not that much space for that much outside of that. So very much, and you know, I am 11 months postpartum for my second, and my other one's 3. So given all of this information that we know, I am just trying to now get sleep, as much sleep where I can. So I'm into sleep.
So am I. That's why we're such good friends. Just have like a sleep party together.
Yeah, just let's sit together and sleep for 12 hours.
Sounds amazing. What's your go-to breakfast?
Eggs of some description.
Nice. Perfect fertility food, side note. And what's one thing that you do daily, apart from your healthy breakfast and your sleep routine, that keeps you hormonally in harmony?
I would say walk. Sure, like live near a beautiful nature reserve and love walking. And even after I've had an initial consultation with a client, I'll go for a walk, I'll process it in my mind, and within the hour's walk I've pretty much written their plan. So then when I get back to my computer, like my fingers are on fire.
Amazing.
But love walking.
Same. And I just got a standing desk.
I've seen
it's I had the standing desk, but I've got the treadmill.
Yeah, treadmill.
Yeah, like walking pad, whatever they're called, and it's literally changed my life.
How often would you go on it?
Like, not on. I realized I was doing it on client days, and I was getting out of breath, which is really bad, because I'd just be like passionately talking to the client for ages,
like how
and then I'd be like huffing and puffing, even at the low speed. So I've realized I'm just going to use it when writing protocols and like doing emails and stuff, and it's amazing. I realized how sedentary I was before, because I just feel like so good. Yeah, it's fine though, not an issue at all, but just not on calls for now, unless I get my cardiovascular fitness up.
Yeah, they're like, you okay?
I felt like Beyonce trying to like sing and perform like the Super Bowl. So I was literally just walking like 1 mile an hour on the treadmill, trying to talk. But yeah, walking is the same for me. Yeah,
and just an enjoyable thing to do. All about the joys.
And I want to learn more about. I'm always asking you, like, give me tips for when I'm a mum. Like, what shall I do? What shall I not do? With you having like the same job as me, but I want in that chatty episode to talk more about your experience with pregnancy and motherhood and all the things. So yeah, can't wait for that other episode. So that'll be your third episode.
I mean,
on the show. Become a regular.
I know. Like, have my little slot.
And we could always do one in person because we don't live too far away. So
we could do the chatty one in person.
Yeah, that'd be fun.
Amazing.
It'll be fun. Amazing. Well, thank you for coming on the show. We'll put all of your links, the products that you've recommended, the websites, and also your personal contact detail. But could you just give us an overview now where people can find you online if they're needing any help with the fertility?
So Rosie Tadman Nutrition, I think, is my handle on Instagram, Facebook, if anybody still uses Facebook, and also my website, Rosie Tadman Nutrition. So yeah, find me there. Got lots of information, all my prices, all my services, everything for everyone to see. And I would always say book in for a discovery call, because it's only really when you get to talk to me and you'll know whether
I think they'll know for after this episode, Rosie, that you're amazing. But it's always good to just share your personal situation and make sure that it's a good fit both sides. But people listening after this, they'll be like, I want to work with Rosie because she's awesome.
Well, I'll take it.
So thank you so much. I really hope you enjoyed this episode. If you did, I would love for you to leave me a rating and review on your podcast app, as this helps to support the show and it allows it to reach more people with this valuable information. Come and say hi over on Instagram. I'm at Viva Natural Health. And if you haven't already, check out my website, vivanaturalhealth.co.uk, for tons more free resources and to discover how I could support you further. I currently offer one-on-one consultation packages if you want my top level support, then more affordable group programs and self-paced online courses. So there really is something for everyone. If you're ready to change and get some answers but aren't sure which option would be best, take that first step today and apply for a free enrollment call on my website, and we'll discuss the best steps for you to take in order to achieve hormonal harmony. Enjoy the rest of your day, and I'll see you back here next week for another episode.